Namaste. I am Rubén Vásquez, and we're going to try a simple posture to help release some of the tightness and tension in the hip joints. That's going to help the knees and the lower back, the lumbar section. So we're going to start sitting in this position with the legs stretched out in front, the hands on the floor. What tends to happen is that for many of us, as we try to sit this way, it seems like it should be so simple, but the pelvis will tilt back and the upper back will round. If this is what is happening for you, I would suggest maybe rolling up your mat or getting a little cushion or a rolled up towel and sitting, placing your sitting bones on it so that the pelvis is lifted a little bit, and notice that then it is easier to avoid tilting back and to instead lift the pelvis up and maybe even tilt it forward a little bit. I'm going to connect to my breath and remove the cushion for now. Placing my hands on my rib cage, trying to expand the sides of the rib cage out to the sides. No strain, no forcing, not creating agitation or pain at any level. Not in the body, not in the mind, not in the breath. I'm breathing, expanding my rib cage out to the sides, and I'm creating a feeling of gratitude for what I am able to do. I'm trying to keep this expansion of the rib cage out and this gentle smile on my face as I'm trying this posture. I'm going to flex the right knee, making sure I'm not twisting the right knee, and then I'm going to try to bring the sole of the right foot against the inner left thigh. The right knee is not twisting. I'm pressing the sitting bones down. I'm using the hands and lifting the torso up. The breastbone up, not forward, but up. The left knee and toes are not rolling out, they're pointing up. I'm trying to get my spine really tall. And then I explore the option of turning my torso towards the left thigh, towards the left knee. And from there, I'm lengthening the spine up and slowly trying to see if I can fold forward. Not rounding the back, but instead lengthening the torso up and then folding at the hip joints. Observing the sensations, engaged leg muscles, expanding the rib cage out to the sides. Easeful breath. Keeping the spine lengthening. No pain, no agitation anywhere, keeping soft smile. I'm going to inhale and lengthen and lift the torso up to vertical. I'm going to stretch that right leg to parallel with the left leg. Pressing the hands down, trying to get tall, and just trying to feel the sensations, differences between the left side and the right side. As I'm ready, I'm going to bend the left knee, flexing, not twisting. Maybe sole of the left foot can press against the inner right thigh. Right leg is not rolling out, its right knee and toes are pointing up, hands on the floor, getting tall. Feel the expansion of the rib cage. See if it makes sense to start turning your mid-torso towards the right knee, right leg. Without losing length along your spine, start folding at the hip joint. Don't lose your smile. Stay with your breath, feeling what is happening. Nothing forced or strained. Notice if you start bringing the breastbone towards the belly button, try to pull away instead. Even if that brings your torso up a little bit, that's okay. I'm noticing that this side is a little bit easier than the first side. On inhalation, you come up. Exhaling, stretching the left leg out. Since the first side was tighter than the second side, I will repeat the first side. So I'm going to suggest that you repeat bending the knee without twisting, pressing the sole of the foot against the inner thigh of the opposite leg, pressing down to help the spine get taller. Keep the knee and toes of the leg that is stretched out pointing up. Turn your torso towards the mid-torso towards the extended leg and explore the option of folding forward. Usually the second time that you do this, it may be a little bit easier. So you notice that what you're doing is working. Feeling and breathing, nothing forced, keep your soft smile. And inhaling, come all the way up. Stretch the leg out, both legs extended in front of you. Take a moment, stabilizing the breath, keeping your smile. Noticing the effects of what we just did. This posture can be very effective in addressing imbalances between the two sides. This is quite normal. But if you practice this way, you may be able to rebalance your body so both sides are equally tight or equally flexible. Take a moment to give thanks for what you're able to do.